Okay,
Huh?
we're rolling.
We're rolling? Okay. Good afternoon. Today is March 28th, 2012. My name is Billy Lolos, and I'm with Occupied Tucson. Today is the last day of 3 days of the Supreme Court hearing arguments regarding the so-called Obamacare, Affordable Health Care Act. And they're arguing about mandatory insurance, and this is going to give you the occupiers' take on health care. Let me start by saying nowhere in the word insurance do I see health care. Insurance is a totally separate entity designed to make a profit. Our health care is being administered by Wall Street. And just to give you some figures, facts and figures of how bad it is, in 2010, we spent $2.6 trillion on health care. That's $8,402 for every man, woman, and child in America. Unfortunately, we have almost 50 million people with no health insurance, and 45,000 people a year die due to no access to health care. We are the only Western industrialized nation that doesn't have some sort of public health care, either single payer or a Medicare type. Now, the insurance companies that administer our health care, they claim they make 30% profit. So 30% of 2.6 trillion, that's 2, 6, and 11 zeros. 30% of that would be 780 billion. And 3 more zeros here. 3, 6, 9, 10. That's $780 billion is their profit, 30% of 2.6 trillion. Now, they also claim that their administrative costs are about 16%. Well, the administrative costs of Medicare is about 5 or 6%. So there's another 10% of this 2.6 trillion, which would be 260 billion. And I'm going to stop with the zeros shortly. So it costs us 1.04 trillion that goes to the insurance company's profits and inflated administrative costs. Now, why do you say our insurance administrative costs so much higher than the Medicare costs? And I'll get into that in a little while. So what's left, if you subtract this from this, you get 1.56 trillion. This is what actually goes for health care. $1.56 trillion. However, we still have 50 million people with no health care coverage. So if we take 15%, which is with 330 million people, 15% of that would be about 49 million. So we take 15%. Let's just round these up to make it easier. We'll go up. So it's 1.6 trillion. Now, if we add 15%, which would be $240 billion, we get $1.84 trillion. And that's what we'd be spending, and we'd have every man, woman, and child with access to health care. Now, if we take this from this, we come out with about $760 billion that we're already spending. We spent it in 2010 for healthcare. So we have 760, $760 billion, $760 billion that we spent in 2010 for healthcare, with 50 million people not having access to it, and we'd be down to $1.84 trillion. So that's $760 billion that we could use for something else or put in our pockets. Now, there's no way, if you eliminated premiums, co-pays, deductibles, and figured out what that comes out to per person, and then figured out what their tax increases would be to cover this number, it would be cheaper for everyone, less expensive. And I know, here it comes. Socialized medicine, the end of the world as we know it. Our democracy is going to go down the toilet. Well, that's totally untrue. Our political system, democracy, and our economic system, capitalism, are independent of each other. You can have one without the other. They're not fused together. We are the only nation, industrialized Western nation, without some sort of single payer or government provided health care. Why? Well, 1.4 trillion a year in profits and administrative costs. So I'm all for socialized medicine. Now, I have an idea that's not new. It's called best practice. They use it in medicine. If there's more than one way to treat a symptom or a disease or a problem, the doctor goes with the best. Insurance companies use it all the time. They do it to lower their cost. If your doctor orders the top of the line medicine, they give you the generic. And I have personal experience from a good friend of mine who almost died because of a gluten allergy, and her doctor prescribed her medicine that was gluten-free. When she went to fill it out, the insurance company gave her the generic. It almost killed her. But they use best practice to reduce their overhead. They're in the business of making money, which is why they want to keep this 1.4 trillion. Now, they use best practice in medicine, in engineering, in therapy. I'm proposing best practice economics. It doesn't have to be capitalism gone wild. We got to take the profit out of our healthcare. And that doesn't mean the doctors make less. Everything would be the same as it is healthcare-wise, except we wouldn't have this 1.4 trillion going to the insurance company, Wall Street. Wall Street is administering our healthcare. Now, best practice economics, there's a lot of economics theories. We happen to use capitalism, and it's capitalism gone wild. It's created a monster that's devouring our democracy, our elections, our political system, healthcare for profit, jail for profit, education for profit. We got to break this capitalism gone wild stranglehold they have on us. It's good enough for the rest of the world. Our healthcare, we don't have any longer lifespan. We don't have the lowest infant mortality rate. In fact, ours is high because of a lot of people without access to healthcare don't get the prenatal care they need. So it's really important that you understand the only thing that will change is this $1.04 trillion that is what insurance companies get for administrating our health care. And we can't survive that way. It's important that we all realize that it's time for us to catch up to the rest of the world as far as healthcare. Take the profit out of healthcare, and this is just one thread in a very large web of injustices that capitalism gone wild perpetrates against the people of the United States, the people of the world, in fact, the planet itself. Keep the faith. We can do this. Thank you very much. Good.